I think, what our study has shown is that financial toxicity is a major issue in families of children with leukemia, that the 2 years of chemotherapy, result in many families, close to a third, experiencing new household material hardship, meaning difficulty, paying for their basic living needs like housing, food, or utilities, or having catastrophic income loss. I think, in terms of what we can do to really better support these families, first is recognizing that that this is a problem and a highly prevalent problem. We need to be asking families throughout the cancer trajectory about their financial situation and whether or not they're struggling or experiencing these difficulties. One of the most notable parts of this study is that 1 in 4 families who had no signs of household material hardship or financial difficulties at the start of therapy at diagnosis went on to develop these. So if you only ask these types of questions or screen for this type of financial problem at the start of treatment, you're going to miss 25% of families who will go on to have those problems. In terms of what are some other direct tools that we can use, I think that's actually really still an area that people are exploring. I don't think we have a great answer yet. Some things that different studies have looked at are different types of financial navigators or counseling type of assistance, whether that's navigating health insurance or navigating how to think about your finances. That's one area of resources, sort of like informational. And then there's also studies that are looking at more resource-directed provisions. Whether that's there's some pilot studies looking at provisioning groceries and transportation support to families. There are studies that are actively being conducted right now looking at directed cash transfers, so serial cash payments to help families. And then I think on a broader level, we need to think about, are there policy things that we can advocate for? I think, certainly things like a national paid leave policy for, caregivers who need to take time off to care for their children, that's something that, could be explored as a potential way to mitigate financial toxicity.